Neonatal resuscitation. So, at birth, we will look for whether the baby is born at full term or gestation is complete, or we will look for good muscle tone and breathing and crying of the baby. If birth is at term, good muscle tone is there and baby is crying, then neonate stays with mother. No resuscitation is needed. Only routine care procedures are taken, like provide warmth, clear airway, dry, and continue to monitor. And if birth is not at term and no muscle tone is there and baby hasn't cried, then immediately we will give the warmth and dry and maintain normal temperature of the baby and clear airway by the suctioning or nasal suctioning if required. And lastly, we will stimulate the baby by tactile stimulation method. Then most of the babies cry after few seconds or few minutes, especially after the tactile stimulation. If baby doesn't cry after the tactile stimulation, then immediately we look for the heart rate, whether it is more than 100 or less than 100 beats per minute, or if the baby is gasping, or if there is any no respiration movement is there, then we will go for the positive pressure ventilation method, which is by the bag and mask ventilation method, and we will give the supplemented oxygen to the patient. And if all these symptoms hasn't appeared, then nothing to worry, only routine care and observation is taken. But by doing all this, if still labored breathing is present or any cyanosis develop, then airway is checked again and positive pressure ventilation is continued for few more seconds and oxygen is given at full concentration. But if no response is achieved and heart rate is also dropping less than 100 beats per minute, then CPR is started. CPR chest compression and breath ratio is 3:1, that is 3 chest compression is followed by 1 breathe. Now CPR is continued for 1 to 2 minutes, and if no response is achieved, like no respiration, no chest movement and no breathing movement is present and no tone of the baby is achieved, also no crying is achieved, then we will go for the endotracheal intubation. And if breathing is achieved, then baby is observed or shifted to the ICU for observation for 24 hours. But if nothing is achieved, then at last intubation is done. Also heart rate is assessed, whether it is less than 60 beats per minute or not, and if cyanosis is developing further more or not, then it is placed into the tracheal and chest compression is continued with the positive pressure ventilation. Oxygen is given at 100% concentration. If still no response is achieved, heart rate is assessed again, whether it is dropping by the 30 beats per minute, then at last we will administer noradrenaline. ADR is given via the ET, or if the IVSS is maintained, then it is given by the IV route. If still the heart rate is less than 30 or 60 beats per minute, then we will consider it as hypovolemia or pneumothorax, or If the patient cries after all these efforts, or any reflex achieves like flexion of the limbs, or any movement is observed, then it is placed for few more minutes and resuscitation is continued for few more minutes. Then baby will improve spontaneously with the efforts, and we will shift the baby to the ICU for further management and mechanical ventilation. Thank you.